So we're going to start again on the recording. This is the last part of the recording of this PowerPoint. This is a basic beginning first aid emergency PowerPoint. So teaching kind of the basics of what you need to know, what you're going to see, and what you need to do. And so let's get started. So abdominal trauma. Penetrating abdominal trauma, usually like a knife or a gun wound, is what we're talking about, a gunshot wound. So back to if it's a penetrating something that's gone in to the abdomen, you don't want to pull it out. If it's a knife or something is in there, we will wrap gauze around and secure that and get them to a facility, a clinical site where they can remove that, because when you pull out anything, you can cut across and cause more harm. So leave it in, support it, and even sometimes you have to pad up to keep it so it's not going like this, but it's steady and you can get them to where they need to go and it's not going to cause harm. Gunshot wounds, what you need to know is if a gunshot wound goes in, you're going to see a small little opening. So if you see a little opening and you know that it looks like they've been shot, the next thing you should be looking for is an exit wound. So you'll have an entrance wound and an exit wound. And so those are things you really need to look at. You want to remove all the clothing to assess gunshot wounds, entrance and exit, because we need to know if it comes in through your upper right chest and it exits out over left lower, it's gone this direction. Think of the damage that bullet could be doing as it going through. If you're hunting people, if you ever hunted and has shot an animal or something, you can see what the damage the bullet does as it goes through the body of the animal. It's not just the entrance. It doesn't just go in and that's it. It goes in and expands and can blow and do a lot of damage internally. If there's no exit wound, then the thought is the bullet's still in there, and that can be very, very harmful too, because it can bounce around and keep causing injury. So always looking for an entrance and an exit wound for gunshot wounds. Obtain as many details about the event. Help predict the extent of the damage. We need to know, did someone come right up on you and shoot you, this far from each other? Or was this a long distance rifle shot? Or was this someone came up and had a knife this long and they stabbed you in and came out with it and ran and you just have a stab wound? That happens. So we need detail. If the person themselves can't get it, you always want people that either been around to tell you what's happened or what happened up to that. Was it a fight? Was it something? Was it just totally unexpected? Did they take off with your wallet and your rings or something? It was a robbery or something. We need to know all of that, because there's a lot. If it was an ex-boyfriend or girlfriend, that's a passionate crime, and they can be a little more gruesome than just someone trying to get some money. So we need the detail because it really will help us. And how long ago did this happen? Did it happen 3 hours ago and he just came in out of the woods and said, I've been shot? Or did it just happen, minutes ago? All of this plays into what's going on, and especially what damage or harm has happened to the person that's injured. Your patient management will depend on the means of the injury. Is it a small little knife like this and went into the fat part of your arm or something? You're not going to die from that. It's going to hurt and it might get infected. We need to probably suture it up and clean it out good. But means of injury, location, like I said, where it is, if it's in where a major organ is, we're very, very concerned. Any associated injuries. So guess what? You get shot and you're on top of a step, you crumple down and then you fall. So now we have a fall downstairs, or a ground level, fall. I hit my head on something. There's other injuries that can take place, and things that could happen, shatter bones, stuff like that. So we need to kind of know where is the actual injury, and associated injuries. And hemodynamic status, we need to know, do you have a pulse? Do you have a blood pressure? Are you breathing? We need to know those things. And neurological status. Are you coherent? Are you unconscious? What is your LOC, your level of consciousness? We need to know if you're confused, if you're in and out, if you have different You're not Perla, you have one pupil blown and one pupil that's reactive. We need to know all of that, and that's part of that survey that you do. But these are things with abdominal traumas. When there is usually something that goes in, if it's a bullet going into the abdominal region, the exit should be out the back, or it could be side to side. It just depends. Get those clothes off, and you need to take a look because we need to know what's happening. Just so you know, though, when you have a bullet that goes out, that wound is much bigger or larger. Same with being electrocuted, and we'll talk about that here in a minute. So here are great pictures that are showing you entry and exit wounds. Um, Sometimes, if you put up your hand like this, or you went like this, and a bullet goes through your hand, you might have an entrance wound through your hand that goes on through and it could enter in through the chest and exit out the back. It depends on the power of the gun, but or where, or what size knife, or what it looks like and stuff. So entrance and exit wounds can be very different looking, and it's so important that you see. And some could be in different locations. Nothing just goes in and out like straight through. It can go downward this way. I had a gentleman once that came in and he had 32 stab wounds on him. And apparently they used a smaller kind of knife, but he was bald. He didn't have any hair, and they had hit his head. And so he had all these gashes, but nothing penetrated the skull. It wasn't strong enough to go through the skull and didn't hit any soft areas that they could get in. So he was talking mad, sitting up, and then he had little wounds all over his back and his arms. And but there were 32 of them, but his head was just torn up where someone went almost like a digging, and so it would come in and then kind of a pull, and he had all these. So we had a lot of suturing and a lot of cleaning and bandaging to be done. So but you need to look for these things. It's important. So here we are, abdominal trauma again. I took my picture down so you could see this slide, all of it. It's important. Blunt abdominal trauma, we can see with seat belts and physical assault. Somebody punches you. Do you see that punch up there? And it's going in. You kind of can see, if you look at that fist going into force and what it's doing to the body, what you're taking in. It's that blunt trauma. Assess for hemorrhage, shock, and damage to internal organs. Cullen sign and Gray Turner sign are two things you need to know for my students for testing. Ding, ding, ding. It's not going to probably be in your ATI. Possibly it is, but you're going to get it from this video and this PowerPoint, and I want you to know it. Cullen sign is a bluish tinge around the umbilicus. It's usually a sign of abdominal hemorrhage. Do you see it down there in the picture on the very bottom? See how it's bruising out? And look also how large that and rotund that belly is, that abdomen. That tells you he is bleeding in the abdomen, and that's what we see, and it's called Cullen sign. Gray Turner sign is ecchymosis or bruising along the flank. It's retroperitoneal bleeding, and we kind of see that in the one over on the in the middle picture. You're seeing a Gray Turner sign kind of, it goes down to the back. We see a lot of Gray Turner signs and issues when we have post-cardiac cath patients that bleed. So they've been accessed through their femoral artery. They've, had their cardiac cath. They've come out and they've done an angioseal or some type of closure, and those patients can't sit up, they can't do this for hours until we know that's truly sealed, because it's a large artery. If it bleeds, they can bleed out. But what happens sometimes is they'll bleed, and they might not be shooting blood out, but what they're doing is internally bleeding. These patients with Gray Turner sign, the ecchymosis or bruising along the flank, it's a retroperitoneal bleed, they're going to have severe back pain. Their back is killing them. That lower back is killing them. They're going to say, my back hurts so bad. Oh my gosh, they can't. And when you turn them, you're going to feel around their groin site, and it might feel okay, might have a little bit of a hematoma, but when you turn them, you see this bruising down that back lower flank, that area, that flank, and that is a sign that they are bleeding. The other thing to do is just go back to hypovolemic shock. Remember we talked about hypovolemic shock? What are we seeing? What are your vital signs? What are you seeing, right? These patients look like death on a cracker. They're going to be pale. They can be diaphoretic. We're going to have hypotension. We'll be tachycardic and tachypnic at first because we're trying to perfuse and oxygenate our tissues. But in time, the heart rate will start to trend down on top of the blood pressure bottoming out. So hypovolemic shock. And if they're bleeding, even internally, we have to replace with blood, but we have to stop the bleeding. That's the ticket. If you don't stop the bleeding, it doesn't matter how much blood you put in them, they're going to continue to bleed out. And you need to think like that. Good slide. So multiple trauma, motor vehicle accidents, most common cause, will have multiple trauma. There'll be more things that are happening to the patient than just one injury, right? You could have a head injury with fractured legs. You can have different things. Falls are the most common cause amongst the elderly. Elderly people fall, and I won't lie, I'm always kind of scared of falling myself, and I'm not considered old, but it is a fear, and fear of falling is real, and they fall and break hips, they fall and have head injuries. We see head injuries, fractures, chest, breathing, airway first. Please remember that, especially for this test for my students, but breathing and airway is always first for anybody. You're not breathing and you don't have an airway, it does not matter how much we pump on your chest. You don't have oxygenated blood, and without oxygenated blood, we cannot keep tissue alive, period. So, usually with motor vehicle collisions, the injuries, head injury, fractures, and chest injuries are expected. These are things we've already previously covered with the flail chest, pneumos, and cardiac tamponades. Just remember that. That's what we can see. And look at this poor fellow. They're doing multi-injuries, multiple things going on. This is a great picture. So metabolic emergencies is another emergency that we need to talk about. This is hypoglycemia. Not everybody that's a diabetic can go into a hypoglycemic state. Some people can based on medications. Some people can for other reasons, you know. So we always want to check a blood sugar on anybody. So when a trauma comes in, we do a sugar to see where they are. As long as they're not bottoming out, we're okay. But lots of times we'll find people unconscious, different things, you know, cold and clammy, hypotensive. They can be just dizzy, tachycardic, all that. They can look like drunks almost. And if that's the case, we need to check their blood sugar. If they're cold and clammy, give them candy. If they're hot and dry, your sugar is high. High or low sugar, super high, super low, you can have different symptoms. Now, they're not going to be cool and clammy. They're going to be hot and dry if it's super high, but they will have an altered LOC. So let's go ahead. If you have a low blood sugar, if they're awake, we can give milk or juice. Milk is high sugar content, guys. If you didn't know that, just so you know, if you know people that are diabetics and they're drinking milk on a regular basis, they're getting sugar. It's a milk sugar. And so it's natural. It's part of the dairy product. So people don't realize that. Or juice. We love orange juice. We love it. It's a high sugar content. But if you have a patient that has renal compromise, they don't need more potassium that's going to come out of the orange juice. What we need is um, apple juice, and apple juice is just a high sugar content as orange juice. So if you have a renal compromised patient, go ahead and give them apple juice, not orange juice. We do not add sugar anymore to our juices, and you still might be seeing nurses do that. That's very, very old school. We used to get an orange juice and take 2 to 4 packages of sugar and pour it in there, mix it up, and give it to the patient. All we're doing to them is making their sugars go super high, and when you go super high, guess what? You go super low. They will drop and bottom back out. So that's not the way to go. You give them juice, and then we want to follow up with a protein snack. Always remember to follow up with a meal high in protein, and then you want to teach patients that they need to make sure they're doing it. Sometimes hypoglycemia takes place based on the insulins they're taking. If they take a longer acting insulin at night before bed and they're fasting all night long, they could wake up in a very low. And that means the physician needs to alter or change their prescription for insulin, how much they're getting. You got to find the sweet spot on that. We can also give IV glucose or IM glucagon. Those are things that we can give to treat sugars if they cannot swallow. So there you go. Clinical cue, renal failure, do not give OJ. You will see that. What do you want to do? You want to give them something else that their kidneys, and apple juice is a good thing to give. We need to get their sugars up though. Now we have environmental, and we talk about that in your survey, in your trauma survey assessment when you're doing it. And we're looking at the E, for exposures. Hot and cold is in that. And so injuries caused by extreme heat or cold, we have different things that we do. So let's take a look at this one. So heat exhaustion can lead to heat stroke. Heat stroke is detrimental. Heat exhaustion we can turn around, but there's signs of it, and we need to first, you can have a rash or edema initially, cramping because we're sweating out, we're losing those electrolytes. Syncope, we can, pass out, get up and pass out, have syncopal episodes, and nausea and vomiting are other signs. You need to be able to spot. We've talked about heat exhaustion in Nursing 101, I believe, if not in 102. And so you need to go back and kind of review what we see with heat exhaustion. But these are some of the signs and symptoms. And the thing of it is you've got to remove a person out of being exposed from that. They can't be laying in the sun still at 100 something degrees if you're trying to cool them down. We need to cool you down and get things. My son just recently had this happen on his job site. He actually was working, and he does welding and pipe fitting and electrical and stuff like that. And he was up, and they're building a big plant, and he was up in this metal kind of box working, and it was during that big heat thing we had, and it was a heat wave or whatever, and it was super hot everywhere. It was like 100 and something. So in the box, it was 100 and like 15 degrees. He was like in a microwave, is what he said he felt like. Well, he got very sick. He got nauseated, he vomited, he felt like he was going to pass out. And so he got out of that. He went to the nurse on site, and they took his temp, and they said you're warm. And so he cooled off, he drank some stuff and all that. Well, he truly suffered heat exhaustion. His kidneys took a hit. He was sick for several days. I mean, he's lucky he didn't die. But the saddest thing about that is the person that, not his foreman was very understanding, but the main guy on the whole site, he was in there, and DJ said, "What's the hottest it can be, or when do you allow people not to work?" And he goes, "It's never too hot to not work. Everybody needs to keep working." So, and there were probably 15 guys that suffered heat exhaustion. No one died, thank goodness, but it could have done some permanent damage. So, remove them from the element, cool them down, rehydrate, all of that's needed. If they're having syncopal episodes, you can lay them down, put their feet up, so we're shunting blood back towards the heart, will help with the blood pressure. So heat stroke, use a fan to lower the temperature, elevate the heat. I've already told you to do that. Apply cold compresses, get fluids, have the person lie down. If they're having an actual heat stroke, they need to lie down. If they're feeling syncopal, have them lie down, because if not, guess what we're going to have? We're going to have emergency injury again, just like what we saw before. And in that emergency, we're going to have other injury. We don't need a head injury because they had a syncopal episode due to heat stroke or heat exhaustion. So lay them down. You want to diagnose the body temperature if it's greater than 106, and neurological dysfunction. This is when we're diagnosing heat stroke. They've gotten this hot. External younger ages, prolonged activity in hot environments. So little kids playing out in the heat, they need to get out when it's super hot. When are the hottest times of the day? You need to think about that. You don't need to be mowing the yard at noon, 1 o'clock, 2 o'clock. You're right. We need to do it really early in the morning or really later in the evening before it gets dark. Non-external, very young, very old, they're all susceptible to heat stroke, chronic disabilities, and alcoholics. Non-external, this occurs with the very young. Brain is not fully developed, or the very old, the brain center is not able to regulate the temperature due to age-related changes in the brain. You always want to limit your outdoor activities, plan activities in the early morning, like I said, and later evenings. But heat stroke, just so you know, and put this in your notes, heat stroke will equal organ failure and brain damage. Ice packs to the groin until the core temperature is down to 102.2. If we're up one greater than 106, you're frying the brain, guys. You're frying a kid's brain. Someone's brain's being fried if we're at that temperature. Small children will seize. You'll have febrile seizures with this. With them, if they get super high fevers, body temperature goes way high, they'll seize. And it doesn't have to go that high to seize. They can get up to 103 and start having febrile seizures. So we want to make sure we cool them down. Symptoms: dry and hot skin. They'll stop sweating at this point when they're in a heat stroke. Before, they're sweating profusely. You could wring out their clothes. They're sweating so badly. That's how they lose all those electrolytes and stuff. But when they're actually in a heat stroke, they're going to be dry. They're not going to sweat anymore. Children will not have tears if they're dehydrated, right? So they could be crying with no tears. You know that they're beyond, and they're not sweating. Convulsions, altered LOC, visual disturbances, dizziness, weakness. They're going to have a weak, rapid, irregular pulse. Those symptoms right there listed are the symptoms you need to know for heat stroke. There's a difference between heat exhaustion and heat stroke. One is we continue to sweat in heat exhaustion. Heat stroke, we do not. So keep learning those things. Go back and review because you've had them. So to prevent, you want to stay hydrated. Non-caffeinated beverages. I know this. I'm always drinking a Diet Coke here and there, or coffee or something with caffeine. It will dehydrate you automatically. It's going to pull water. They say every caffeinated beverage you drink, you should drink 8 ounces of water on top of that. So if you're already getting your water in, but you're drinking 4 Cokes, you're going to still have to do 32 more ounces of water to replace what the caffeine has pulled out of your system. That makes sense. So low sugar. We don't need to be hyped up on the sugar, and non-alcoholic beverages. Don't be chugging the beer out there in the heat. And what do people do on the lake? Out in the heat all day, drinking all the alcohol they want. One, it makes it worse as far as their drunkenness, but two, they can really hurt themselves worse than that. Limit exertion. Wear light, loose, light-fitting colored clothes. Don't be in the big coat, all up like this. My middle son, he, in his younger, like sixth, seventh grade age, he always wore a coat all the time. And I was like, you look like the Unabomber. We need the coat to be gone. You said it's too warm out to have a coat on. And that was a fight for a while. And then one day I just tossed the coat and stopped that. But he would come home just hot. And I'm like, take the coat off. And I think he was a little self-conscious about how he looked. Bullies are bullies. And, they're bullying him about how he looked or whatever. So he would wear a coat to cover up. And that's just pitiful. Get it off. You need to wear light, loose-fitting clothes, and bullies should be ashamed. Treatment: cooled immediately. We need to cool them down. We got to get the temperature down. Heat stroke, because it is causing brain damage. We are frying the brain. So cool them down. This little child over here, you see ice packs in the groin, under the armpits, and in the neck. We can do that to bring the temperature down. In hospital treatment, cooling blankets are used, infusion of cool fluids, ice packs to the groin and axilla under core temperature to 102.2. So we're going to drop them. We want to drop the temperature, but you don't want to drop them too fast. You don't want to go from 105 whatever to 98.6. We can cause them to have other issues because of that. Instead, we need to go slow and we need to cool them off, but we need to get it down. You can't just be doing it over a 24-hour period. But what we need to do is bring them down to about 102.2, and then the body can start to regulate and cool itself at that point. So that's the magic number. So hypothermia, this is the one we haven't really studied. So let's talk about it. Most at risk are older adults, the very young, of course, and that's lack of circulation for the older adults. They're more at risk. They don't have as much fatty tissue. They're starting to thin, skin's starting to thin. Very young, same thing. They're not protected as well. And very thin children, because they don't have that fatty surface to protect them. They're at risk. Mentally ill, because they're not going to protect themselves from the cold. They might go running out in their shorts and a sweatshirt, nothing else, and it's below freezing. They're going to cause hypothermia issues. Homeless, and the impaired. So homeless is another ball game, a lot of mental illness there in the homeless world. But if you're out in the element, they're the ones that the homeless are the ones that usually we see in the ERs that have frozen due to the cold. They'll come in dead, frozen. We have to, uh, you're not considered dead. And this is so kind of blunt and cold, but I'll just say it. You're not considered dead until you're warm and dead. So if you come in and your body temperature is very low and you're hypothermic or frozen, we have to warm you up before we can pronounce you dead. And that's because the heart can start back. We can't shock a cold heart, but we could get some rhythm that we could shock. So the cold's a little different, and we'll talk more about it. Symptoms of hypothermia: shivering. Shivering is an energy waster. If you shiver and shiver and shiver, you are wasting energy. And if we're wasting energy, what are we wasting? Glucose and oxygen. It eats up our oxygen because of that. So we don't like people to shiver. It's not a good thing. Cardiac dysrhythmias. We can have abnormal rhythms. Respiratory failure, loss of coordination, and loss of consciousness. If you have ever watched anything about the people that hike those higher elevation Mount Everest, those documentaries, if you've ever seen where they ended up getting stuck and a storm comes in and stuff, they'll become um, they'll become confused and disoriented, and eventually they'll lose their coordination. They can't hike anymore. They just can sit down. They can't do anything, and then they'll lose consciousness and freeze. Severe, you'll have pulse and respirations are going to be hard to detect, absent reflexes, and they'll be unconscious, just so you know. Prevention: eating high energy foods, exercising, wearing layers, and covering head and feet. Why would you think that would be prevention? Well, we burn a lot when we're cold. Our bodies are trying to warm themselves. We're burning up energy. So if we eat those, we can feed and keep ourselves warm. Um, and then exercising is that cardiopulmonary piece and getting ourselves ready for that. Treatment: rewarming. We got to warm them up, guys. That's how you stop hypothermia. You freezing, you get warm. Simple as that. So by saying that, it's slow rewarm. Too fast, you can throw them into lethal arrhythmias. So if they do have a pulse, but they're hypothermic and you're trying to warm them up, if you warm them up too fast, you're going to throw them into lethal arrhythmias, and you can't shock them when they're cold. So we have to wait till they get to a certain temperature to shock that rhythm. So we want to warm very slowly. It's not something you just do. In the hospital, we'll use warming blankets, continuous cardiac monitoring, warm intravenous fluids. We'll use fluid warmers. So if they're real hot, we're gonna have cool stuff going in them. If they're real cold, we're gonna have warm stuff going in them. And the key is to slowly rewarm. And you also can cool, but you don't want to cool too fast either. But the rewarm is a little different, because warming them too quickly, we will throw them into lethal arrhythmias. And you cannot shock a cold body, FYI. Rectal probes are most commonly used to monitor patients in hypothermia. If you use a rewarming continuous warming system that you put under on their mattress, we have those too. We can cool them with it and we can warm them with it. If you put in the warming and you're warming them up, we would want to do that very slowly. But they usually, when we put things in like that, we'll have a continuous rectal probe. So we're continuously looking and monitoring temperature, accurate temperature. And so while they're laying there, and this is how we will monitor them, and it's very important that we do monitor their temperature, and they need to be on cardiac monitoring because they'll have these arrhythmias, and we want to make sure they're not going into anything lethal. So looking at this: prevention: eating high energy foods, exercising, wearing clothes, covering your head, rewarming, slow rewarm. We've already had that. And the rhythm that we'll see a lot is ventricular fibrillation, not VTAT, but VFib. So just think about that. Go back and look at your strip that you learned on the last test for my students of what VFib looks like. So we want to go slow because you don't want to throw them into V-fib. In a hospital, we're going to use the things that I've already said, but the little picture up here, and I redo all of this because it's important, but this little picture is the hat that covers head and ears. Think about your ears. They're going to suffer frostbite very easy. There's not much there. Cartilage. Scarf that covers face and nose. Nose will be one that will go because it sticks out and it's there. There's not a lot of tissue on a nose. It'll freeze fast. And water resistant winter coat. You don't want anything to get you wet because wet will keep you cool. And so we want to make sure that we don't get wet with this. One of the things you need to realize about hypothermia, it could be 85 degrees outside. And if you're, say, bicycling or something, or exerting yourself going on like a 3-mile hike or something like that, you can actually throw yourself into hypothermia if you're not careful. Because if you sweat off everything and say a rainstorm comes or something, you get wet, you can start to lose your own body temperature fast. And doing that, it'll drop and it can throw you into a state of confusion and hypothermia. You're not going to be down at like a below 0 degree, but you can have the signs and symptoms. So that's why it's important you wear rain gear and stuff like that and keep yourself dry and warm. Dry and warm's good. The heart is extremely sensitive to cold, so rewarming too fast can cause the cold blood in the extremities, which can get a lot colder than your core, to go rushing to the heart, and that's what causes our V-fib. And remember, B-fib, you defib. So if we have ventricular fibrillation, we're going to defibrillate that. So B-fib equals defib. Remember that. So frostbite can happen. These are some pretty gruesome pictures, but this is what it looks like. So frostbite is constrictions of blood vessels, which damages vessels and tissues, which lead to blood clots. And then they're going to occlude, the clots occlude blood flow. There's 4 stages, much like wound and burns. To treat for frostbite, you want to place in heated water, 100 to 100 degrees, for about 15 to 30 minutes. Longer for deeper injuries. Do not rewarm if refreezing may occur. So you don't want to get them warm if they're out there in the wild and then they're going to freeze again because you're going to cause more damage and loss of tissue. Never rub, ding, 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 never rub or massage frostbite areas. And the frostbite is not just the blackened area that you're seeing on those pictures. Frostbite, if you look at the fingers in the center picture, do you see how they're pink and red and it comes on up and there's bruising as well? That is all damage done on that hand. So if you massage the very tips that are black, they can fall off because they're truly dead necrosed tissue. But the rest of that's injured tissue. And if you massage that, you can cause more damage to that tissue. It's not going to do well. So do never rub or massage that tissue. Debridement and skin grafting and amputation will take place with frostbite. So these people are going to lose their feet. She's going to lose her fingers, part of her hand probably. And this girl has the tip of her nose, her lips, her cheek. It looks like eyes. She doesn't look good, does she? So most common frostbite areas are fingers, toes, cheeks, and nose. We talked about it. Very little tissue. Circulation's a little different there. So it's faster to freeze. Frostbite is often seen in homeless, alcoholic, and drug abuse people. They're out in the element. They can't get away. Alcohol makes them feel warm. So it gives you a false sense of warmth. And so you are more apt to suffer hypothermia and into frostbite if you're not careful, if you're an alcoholic. So you want to be very, very careful. If you pass out, you cannot feel the effects of the cold. So people feel warm, they drink, they're cold, they'll drink a little more, they feel that warmth kind of, and then eventually if they pass out, they're not even going to feel, they're just going to freeze. It's really a sad situation if you ask me. So poisoning is a big one. This is our next emergency. I want you to look at the graph to the right. It's from 1999 to 2019. It's not even the newest numbers, which will be still climbing high, and add fentanyl into this mix. It's a hot mess. So these are the overdoses, deaths from opioids. It's very sad that we've lost this many people. It's the number one in the U.S. is opioid drug overdose. Controlled and prescribing and dispensing of Schedule II drugs. That's something that needs to be controlled. Used to, what happened is doctors would give you a script for a pain med, for an opioid, and say, oh, you've had surgery, here you go. Here is 45 pain pills. Um, but they've really come down on that and they're controlling that. So now you go have surgery and they go, here's 5 pain pills. Good luck, use over the counter stuff after that. Other drugs that can increase the effects of opioids if used in combination. You need to know this. Gabapentin and loperamide are 2 drugs. Look them up. We give them a lot, but they can give you a better high or a bigger increase in effect of an opioid. So lots of times giving them together, you can give a little less and you get a little bit more. And so it's kind of a trick a doctor can do to help give them more relief. But here's the other thing. Patients realize they can get more relief. And so they can even ask for certain things and all that. Naloxone is Narcan. That is our drug that we can give to reverse opioid overdose. So you push Narcan very quickly. And that is what we want to do if someone is overdosed. If you find someone, give it to them quickly. Just so you know, loperamide is a synthetic opioid that primarily affects the opioid receptors in the intestine and is used to treat diarrhea. Yay. So there you go. So back to poisoning, we're still here. Children, a lot of children get overdosed by curiosity. Bright colors, different gummies are out there, gummy everything. I love gummy vitamins. That's what I like. But kids will eat a whole bottle because it tastes like candy or it looks like candy or they'll drink stuff. One of the most horrible things I think I had to deal with in my career was a small child who drank oil that goes into hurricane lamps. You know how you can get it in bright colors? It can come in green, yellow, whatever, orange. You can get whatever color you want. It doesn't have a smell or a taste, and they drink it. They think it looks like Kool-Aid or something, so they chug it, and it can be detrimental to them. So elderly can overdose on medications very easily. They're at an increased risk because of medications. They get a lot of medicines to take, prescriptions change, can you do this, can you do that, and they're at a high risk for poisoning because they can't seem to follow the regimen or they're given too much. That happens a lot too. The thing to do is called poison control. Everybody that has a small child, and truly anybody and everybody should have poison control in the refrigerator, somewhere where they can find a phone number when in an emergency to call. Poison control gives advice about severity and toxicity and treatment options. They're going to tell you if you need to go to the ER immediately. They're going to tell you to make your child or someone throw up. They're going to tell you not to make them throw up. Try to not to. Give them a glass of milk to drink. Do this, that, or the other. But most of the time, no matter what, if a person is overdosed on something, they're going to send them to the hospital so that they can have labs drawn and look at renal function and give them fluids and stuff and get them through and over the hump of it so that they come out the other side okay. Hospital treatments, the hospitals call poison control. I've called poison control out of the ER before to report and see what we should do. We can give activated charcoal. It'll decrease the absorption of the drug if they're taking a bunch of pills. Anything by mouth that's going into the stomach, we can give them activated charcoal. It is black like charcoal. It is very, very messy. It stains clothes, but it goes down. And then usually what happens is we put it down, let it absorb, and then we pull it up. It's a mess. They'll have black mouths. It's just not very pleasant at all, but it works. NG tube, we can put an NG tube down. Sometimes we'll do activated charcoal. We do it down the NG tube into the stomach, and then we can have them hold it in place, get it down there. Lots of times they'll throw this stuff up. They're not happy with it, but that's what we want. Absorb, puke it up, get it out. Sorbitol, same thing, an antidote to poison. So those things, there's different antidotes depending on what, but there's a lot of poisons out there. People don't realize, and animals are affected by poisons. That's one of the things. I don't have small children anymore, but I have a dog. And so I was putting out mouse poisoning. And so one of the things I had to make very sure is that my dog couldn't get it because it could harm him. But I'm over the rodent. So there you go. The little field mice want to come in. It's sad, but I can't have them living with me. Sorry, folks. So, poisoning, who you gonna call? Poison control. Everybody needs it. Who you gonna call? Poison control. What are you gonna tell mamas and daddies when they have babies and they're going home with their babies or their children from the pediatric clinic? Here is the number for poison control. Put it on if your baby or child gets into something that you're fearful of or worried that can cause them harm, have them call this number immediately. You could call 911 if they're unconscious or they have a change in level of consciousness or something like that. Then you want to call 911, but you want to call poison control too because they might be able to help you and tell you what to do. Anyway, who are you going to call? The poison control. So animal bites, bug bites, and stings. I'm going to go a little quickly because I want to get this done. We're already pretty far into this lecture. So here we go. I'm just clicking on over as we're recording. Okay, animal bites. Look at that little cat and dog biting. Suspect rabies if it is a wild animal. If you are bit by a wild animal, you need to suspect rabies, always. We also worry about our dogs and cat bites. If we have a dog or cat bite, flush it because of the infection. What's in their mouth is going in and penetrating into your bloodstream. That's how we get really bad infections and illness due to cat and dog bites, animal bites. Rinse immediately, flush it, rinse it immediately, apply antibiotic ointment to it and bandage it. Lots of times if it's bleeding, let it bleed a little as you're flushing and cleansing it out. Bleeding is a good thing as long as you're not profusely bleeding, but we want it to be cleansed. And then you need a tetanus booster, remember, every 5 years. So if you get a bite, something goes on, you need to go to your doctor, or you can go to a walk-in clinic, or if it's really bad and you need a suture or you need some cleansing or something, go to the ER and get a tetanus too while you're there. You want to rinse the bite for 5 to 10 minutes with soap and warm running water. That's a long time. Look at your watch, look at a clock, 5 to 10 minutes. And I'm going to tell you something on one of these. If you tell me I need to do it 5 to 10 minutes, I'm going to wash it for 10. So rabies, let's talk about it. Victim is given immune globulin, 20 units per kg around the wound and remainder IM. So they're going to go around, inject, follow up with a series of IM injections post days 3, 7, and 14. Anybody who's ever had to go through rabies shots, it is not a very pleasant thing. It's something that it takes a lot of time. And you look at what post days 3, 7, and 14. So you're going 2 weeks out from the bite and still getting injections. My neighbor one time got bit by a squirrel and he had to get rabies injections. He was a younger guy. I was in high school at the time and I was like, ooh. They'll be given antibiotics. They can contact your local animal control. They need to examine the animal. But I'm going to tell you something, and it's sad and it can be very disheartening. But you cannot check for rabies except through a brain of an animal, and that means the animal has to be put down. So that's why it's so important to get your pets their rabies shots so that they don't have to be put down if they ever bite someone or you. But a wild animal needs to be properly killed and brought in to local animal control so that they can test the animal for rabies. This is a video. The link is in the PowerPoint. About 5,000 animals, most wildlife, test positive for rabies each year in the U.S. And that cute little raccoon that everybody just loves. People want to touch wild animals. Do not. Don't touch their babies either. One, you're going to cause them harm. The mamas won't want to take the baby back. But the other thing is mamas will protect them and you're going to get eaten. The bear's going to eat you. When a bear mama goes after people that are messing with their babies, I kind of don't blame her. I don't want to see her kill anyone. But come on, folks. If that were your baby and somebody was coming after it, you would fight. So watch the video. The link is in the PowerPoints under YouTube and is in the PowerPoint that I put up for my students in my folder under week 8. I'm not going to stay long on this actual slide, but it is interesting. I want you to look at it. It's what is the most positive in the state of North Carolina 2020 percent of positivity by species. Raccoon, 112. So coons are pretty rabid. Skunks, fox, bats, cows, cats, cows, dogs, coyotes, woodchucks, sheep, and equine or horses, if you didn't know what that was. Interesting. But these are different graphs and stuff that kind of show you that. I find that kind of fascinating just to see. I don't know about you guys, but snakes freak me out. I'm not a big snake person. Now, I don't kill good snakes, but I'll kill a bad snake. And good snakes eat bad snakes. So keep your good snakes around. They also eat rodents, so I'm all about it. In the United States, approximately 8,000 snake bites occur annually. Approximately 2,000 are from poisonous snakes. Don't you just love statistics like that? You're just like, really? I am now scared I'm going to be one of those people, because that's quite a few if you think about it. So let's look at snakes. So snake bites. Symptoms of poisonous snake bites: 2 fang marks, sometimes 1, severe pain and swelling, discoloration at the site of the venom, nausea and vomiting, respiratory distress, changes in vision, sweating, increased saliva production. Treatment: we got to get to a hospital, debride the area and irrigate it, use an anti-venom, then a tetanus booster, prophylactic antibiotics, and symptom management. In the field, we want to wash the wound. Lower the extremity. You don't want the blood from where it's coming. If it's in the hand or arm, you don't want it going right to the heart. Lower it down below the heart. Try to keep things down local. Keep the victim calm, because what happens if you freak out? Heartbeat will go up. Respiratory rate goes up. And if I'm pumping blood faster and working things through, I'm going to take that venom faster through my system, and definitely seek for help. One of the things that people don't realize is that some hospitals don't have antivenom. You have to send them to hospitals that have it, or you have to contact a hospital to get it sent to you. So if you know a poisonous snake bite's coming in, the other thing is identifying the snake. That is something that's always a little different, because people are like, you want me to bring the snake to the ER? And we're like, yeah, but could you kill it first? We've had people bring live snakes to the ER. So anyway, kill the snake, bring it in. If you're going to be harmed by the snake, or you can't, at least get a good look at it so you can describe it, or take a photo of it if you can, because we can identify them. But just remember, we need to wash the wound if we're in the field, lower the extremity, and keep them calm. Calm is good. Just slow, just it's going to be okay. We're going to get there. Get them to a hospital as fast as you can to get the anti-venom in them, because that's what's going to counter the venom if it's a poisonous snake. Shock can occur if you do not do prompt intervention. They'll go into shock. Why would it be important to keep the victim calm? And this is what I just talked about. We want to keep the heart rate down because we don't want that venom pumping through the body fast. So the do nots, and it's kind of sad that I have to teach it, but you do. And I will tell you, if I had not been a nurse and knew this, I would probably go by what I saw on TV, right? What I saw growing up. So do not apply suction. Do not make incisions over the wound. Do not suck on the wound. Used to, you would see old cowboys cut it and suck the poison out, right? And suck the poison out. Right, we do not do that. Do not do that. Do not apply ice. Ice is going to cause more damage to the tissue there. It can cause more issue. And we do not want to give any stimulants or alcohol. So it's not time to smoke a cigarette. It's not time to drink a big Coke. Let's not swig whiskey if you have a snake bite. That is not the way to go. We need to stay calm. We need to keep the heart rate down. Think of what all those things do to your body. That's the things we don't want to happen to the body. We need to stay all in a state of as best as possible. It's hard because you're scared. And then secondly, and just so you know, even non-venomous snakes, you still have to clean those wounds and stuff if you're bit by a non-venomous snake, because they can get major infections. So, you know, we had a girl who was out in the woods, and it was a little green, some kind of snake, bit her on the leg. She knew it was non-poisonous. She wasn't too worried about it. It hurt. She kind of rubbed it a little bit and went on and finished her hike. She didn't go to the doctor, took her normal shower, everything. 2 days later, they're streaking red all the way up her leg. It was a rip-roaring infection. It was an infection she had to be hospitalized and get antibiotics for. So there you go. And she had to have a little bit of debridement from the wound itself, from where the bite was. You can see the two fang marks up at the top. So there you go. Seek help. So I love the snake part. I'm going to turn me off for a minute so you can see all the snakes that I have up here. Copperhead, poisonous snakes in North Carolina. So we have a lot of snake bites in our state, guys. So that's something, that's why we teach this, because it's something to understand and know a little bit about, so that you're not just so freaked out if this happens to you in your community, or if you're working in a clinical setting where you come across people that come in with snake bites. The copperhead is throughout the entire state, so, and it has a copperhead, as you can see. Timber throughout. Eastern diamondback is in the southeast of the state. Pygmy rattlesnakes are in the eastern part of the states. Coral snakes are in the southeastern. We see coral snakes in Florida a lot. And water moccasins are in the eastern. So they're near the water lakes. You can find them. Water moccasins are aggressive. There's some snakes that aren't very aggressive, but it seems the poisonous ones are a little more aggressive. Lots of times they'll just protecting themselves. They're scared and they decide to protect themselves. I've heard of water moccasins going after boats and getting up in boats. They're not happy. They're not happy little creatures. The water moccasins down there at the bottom, that little dark looking thing, they're just vicious. 37 species of snakes are found in North Carolina, but 5 venomous snakes cause the majority of snake bite poisonings. So more people getting snake bites in central North Carolina as they spend time outdoors during COVID-19 pandemic. Pretty interesting. So when COVID hit and everybody went outside because they said don't be inside, we had an uptick of snake bites. There you go. This is a video of a copperhead clip, nest of copperheads. That just gives me the heebie-jeebies just looking at it. Even if you hate snakes, take a look. It's 1:26, but it'll show you what real copperheads look like. We have them all over our state. If you live here in the state of North Carolina, my advice is for you to see it. If you want to come visit our state, it'd be nice to know if you knew what snakes were out there. So what I'm saying is go ahead and watch it if you absolutely just can't because you have some phobia about a snake. I don't like them at all. They scare me to death. But I watch it because I know they're out there and I want to be able to do the right thing. This is a link. My students have the PowerPoint already up under week 8 folder. And for everybody else, I've posted links on the description in YouTube. So bug bites and stings. Systemic reaction to the bites and stings of insects and bees account for more deaths each year in the United States than do snake bites. So insects are not our friends. They do a lot of things. We need them for many things, but they can be very harmful to us. So we've talked about anaphylaxis and anaphylactic shock. Here we go, guys. This is where this comes into play. This is where we'll see a lot. Sometimes it's from food, allergies to food, but we see it from bug bites and stings. So life-threatening would be anaphylaxis. And so hives, swelling, weakness, chest pain, abdominal cramps, contrition of throat. We get the throat, scratchy swelling of throat, tongue is swelling, loss of consciousness, and then death. That's what we see. Interval between symptoms and the sting or bite is short. Possibility of death rises. So more stings, more bites, the worse we are. Okay. So here we go. You need to know your epi. Epinephrine is 1 in 1,000. It's in dosages of 0.5 milliliters saline mixed in with saline for adults and 0.15 milliliters for children. So I want you to know 0.5 for an adult and 0.15 milliliters for a child. Those two numbers you need to know. Epinephrine, Benadryl, ice packs. Benadryl is an antihistamine. We're trying to stop that histamine response. Repeat epi if symptoms persist after 20 minutes post administration. So you're going to give the epi. You're going to wait. If in 20 minutes they're not any better, you're going to give more epi. If they are better, then we're good. We're going to sit and watch. But sometimes what happens with people, they can get a little bit better and then they start to go down again and get worse. So you want to watch someone that's having an actual allergic reaction to a bug or bite or sting. If in shock, keep warm, remain lying down with legs elevated and head flat. Apply paste or baking soda of water or ammonia and cold compress to bee stings. We want to draw out, we want to neutralize the sting. That's what we're doing with baking soda and water or ammonia. And we want to cool it down. We want to keep blood flow away from it because we want to stop that allergic reaction. So we're going to slow everything down. Cold compresses help. Remove the stinger. Do not use tweezers. Don't go pulling on a stinger. You're just going to push venom into the person more, cause more harm. Use a credit card and scrape out the stinger. So you want to, if there's a stinger, you're going to, not away from it. If the stinger's going in this way, we're going to pull this way and scrape it out. You want to kind of pull it out gently, the way. If it goes in this, you're going to pull this way. If it goes in this, you're going to pull this way. I hope that makes sense. So poisonous spiders in North Carolina, we have black widows and we have brown recluses. Both can cause death to tissue. And so it's so very important that you seek out medical help if you are bit by either spider. If you look at the brown recluse over to the right, it's by the penny. It's not a very big spider, but it can cause some major, major damage. It literally, the tissue starts to die. It'll necrose. The brown recluse spider is smaller than most people realize. Notice it beside the penny is what it says there at the bottom. And it is, it's teeny. But the black widow is the black, it's got the really big belly. I called it belly, it's not really that, but and on the other side of it, you have the hourglass, the red hourglass. So that's where she gets her name. She is the female in that world. She kills her males. So this is a YouTube video too. I don't see a link to it. My students should be able to click on, if you download the PowerPoint, to click onto the videos. When I'm talking, you really can't, but this is showing you where a black widow is hidden. They can be hidden in a lot of stuff, and that's why people get bit by them, because they don't see them. You know, if you see it, you're not going to buy it, get near it. But they'll be reaching into something or picking up wood, firewood and stuff, and they get bit. They're around. This is another video that is a YouTube video. The link is on there. It's a brown recluse spider, and it just shows you what they look like and you can see it a little so you can identify. Stay away from, but you need to be able to identify. So they really aren't out to come to attack and kill us. You know, we get all paranoid about things like that. Truth is, black widows avoid humans. They build their webs in tight spaces close to the ground. But when the widow bites, especially the female, its venom is far more powerful than a rattlesnake. It's juice, venom. So they're pretty potent creatures. So black widows, their bite may feel like a pinprick and may not be obvious. This happens a lot. People get bit by spiders and don't realize it. Within a few hours, they'll have abdominal pain and muscle cramps. You will. Other symptoms include nausea, vomiting, chest pain, and respiratory distress. They're lethal. Brown recluse usually get unnoticed. Symptoms within several hours after the bite. You know, severe pain, itching, nausea, vomiting, fever, and muscle pain. Fluid-filled blister forms, and it's hard to heal ulcer. The tissue will actually necrose. You have to go, and the doctor will have to debride the tissue. So, and it'll continue to die. So that's why it's so important you go and get seen for either sting. So, treatment, spiders, scorpions, and other poisonous insects. We have an anti-venom to specific poisonous creatures. We can give things that will reverse with black widows, things like that. It is stocked in EDs and clinics in rural areas. It's very interesting. So if you live in the kind of down Winston-Salem area, stuff like that, there's a very small County Hospital, Stokes County, has a little hospital up there, and it's up Hanging Rock where everybody goes in hot. It's actually a hospital. It's very small, little small ER. Great nurses. I took students there. I love them. Great nurses that I love dearly. And but they have antivenom. It's great. And they carry it because they get the snake bites. People are up there hiking everywhere around that mountain and they come to them first. So they're able to give the antivenom and then get them flown out to a big hospital. Ticks are nasty little creatures. Rocky Mountain spotted fever is something we see. Lyme disease in our area is huge. And right now we are having people come up with Lyme disease and they've never found a tick on them. So it's very, very important, signs and symptoms, get checked. And truly, if you're having some issues, we have someone just recently, their child kept getting fevers and feeling sick, and then she'd get better. She's about 3, 4 years old. And never found a tick on her, but they finally took her, couldn't figure out what's going on, and they checked her for Lyme's and she was Lyme's positive. So it's important. You want to know how to remove a tick, period. Grasp ticks as close to the skin as possible with tweezers and pull it straight out, not twisting. Do not apply, and I have to say this because this is old school stuff, old world, grandma stuff. Do not apply turpentine, mineral oil, petroleum jelly, nail polish, or insecticide on the tick. They may regurgitate stomach contents into the skin. So they can cause a little more harm if you do this. Because I will tell you, I have done that with an animal, one of my dogs. I put Vaseline on it and backed it out. But they say not to do that. So do not do that. And if you see that on testing, that's a big no-no. You might, and your grandma might, and you might swear by it, but you don't do it when it comes to nursing. So these are things that can happen. There is another Lone Star tick that is out there, and if you're stung by the Lone Star tick, you can no longer ever eat beef protein, any kind of meat protein again. It can become lethal for you. And that means dairy or meat, I think of both of those. It's something to look up. It's kind of interesting, and it's very scary. My fella, one of his friends that worked for the state agriculture was bit by that tick, and he cannot have any kind of meat at all. No beef, no anything. So, and no dairy. I think that would be horrible. And when somebody says no to you, you really won't. So very last is a tick removal video to watch. The link is there. Once again, it is in the description on the YouTube channel, but it is also for my students. It is posted go through the slideshow, the PowerPoint I put up for you. It's not recorded, and you can click on those links. The links are in each slide, so you can get to those, but it's a good one to watch, and you need to know how to remove a tick, period. I hope this helps. So I'm finishing up. And please, next time there's an emergency, stay calm, call for help, and do what you can do and know best. And hopefully this whole PowerPoint series has helped you. Good luck.